Good afternoon, everybody. My name is Peter Clegg, and I work for this group here, which is the Medical Device Technology Group, which is a subdivision of the Department of Physics at the University of Bath. We're headed up by Professor Nigel Cronin. I'm his postdoc research officer, and these two logos here are our industrial sponsors. So this is Microsulis Medical Limited, and this is a rebranding of Microsulis to deal with the oncology products we're currently working with. And I'd like to speak to you today about some of the developments we've been carrying out over the last 15 years in microwaves for medical therapy. So just to give you a brief timeline of the things we've done. So around 1994, we kicked off with an endometrial ablation system, which is a treatment for a gynecological condition called menorrhagia. It's a condition that affects around 30 to 40% of women in their early 40s, that kind of age bracket. And the customary medical treatment for it is a hysterectomy. So at the University of Bath, along with the Royal United Hospital there in Bath, we developed a system for treating the inside of the uterus with a microwave device which avoids hysterectomy. And that's been an extremely successful treatment. Currently done something like 75,000 treatments worldwide. From there, the company Microsulis was spun off to do the commercial development of that university research on microwave endometrial ablation. So from there we moved on to soft tissue ablation, which is the destruction of any unwanted tissue. And so that is principally malignant tumors at surgery. Following on from there, we've gone on to develop smaller and smaller devices which can be used in a radiological setting. So there's a much larger market in radiology treatments because they're fast and very cheap to do and save the National Health Service an awful lot of money. So in 2006, we obtained a CE mark, so that is approval to market this percutaneous device in Europe, and also an FDA 510K clearance for marketing in the United States. 2010, for 2006, that was for the open surgical device which we have. In 2010, we got those same approvals for the much smaller radiological device to market in Europe and the United States. Just to give you an idea of what these things do, microwave endometrial ablation, this is a minimally invasive treatment. We have a microwave antenna which is inserted transcervically into the uterus, and it's manipulated inside the uterus and just treats the endometrial lining. What you're doing is essentially you're destroying the endometrium but leaving the rest of the uterus intact. So it completely avoids the need for hysterectomy. And this treatment can be done in outpatients under local anaesthetic and takes literally minutes to do. So you avoid a major surgery, very traumatic surgery, 3 months off work to recover. So that has been a big success. So moving on from the gynecology into the oncology market, we first started off with a device for treating tumours at open surgery. So this is where the patient is undergoing a laparotomy and probably having a section of the liver removed by resection. But also, if you have disease in both parts of the liver, you may well wish to ablate a tumour which is in the part of the liver you can't resect. So here we have a liver. This is the right lobe, this is the left lobe. And the idea is to place a microwave antenna into the tumour and energize it and ablate the tumour, just destroy the tumour in situ. What we've got here also is a temperature probe, so we can monitor the temperature at the edge of the tumour and make sure that tumour's been destroyed. Also, we use ultrasound guidance. You can image this destruction of the tumour going on by steam evolution, essentially, and that images very well at ultrasound. So that's the basic principle of what we're trying to do at open surgery. So down to some finer details of the device that we developed to do that. This is the MTA, so this is microwave tissue ablation. So this is the device we use at open surgery to destroy tumor tissue. And this is a computer model showing where the energy is being deposited in the tissue. And you can see this nice sort of spherical field distribution. I think the battery's going on this. Yes. So you have a field distribution like that around the applicator tip. And over in the right-hand photograph, you can see the effect in benchtop liver experiment. So this is just a bovine liver, a cow's liver. We put the applicator in there and energized it. And you can see the volume of necrosis that we can achieve with that kind of device. It's very, very fast, this thing. It operates in about a few minutes to give you something like a 5 centimeter diameter ablation. So it's much, much quicker than other devices that have been used in the past. So very effective, and surgeons like this a lot. In addition, to go along with that interstitial device for treating tumors, we developed a surface applicator which launches the energy forwards. This no longer wants to work. So in the left-hand computer simulation, you can see the energy being launched forward from the applicator into a simulated block of tissue. And in the right-hand, rather more dramatic photographs, you can see what the effect of that is in surgery. So we see a liver there in the top photograph, and you can see the flat-faced applicator in the top there on the surface of the liver. And each of the little white spots that you see is a tumor deposit existing at the surface of the liver. And in this procedure that we did there, the left lobe of the liver had a large amount of disease in it and was going to be resected. So we did a little treatment on a small deposit of tumor, and after resection we could section it and have a look at the effect. And you can see the white blob there is a small tumor, a 1 centimeter tumor at the surface. And you can see that that surface applicator treatment has completely treated that entire zone. And it does that in less than a minute. So it's a very, very fast, very intuitive device for surgeons to use, and is consequently popular. So moving on from these open surgical devices, we put in a lot of effort into making smaller and smaller devices which can be deployed in a radiological setting by an interventional radiologist. And in order to do that, we need to get that device diameter down to less than 2 millimeters. And here you can see a computer simulation of the field around one of these 1.8 millimeter, what we call percutaneous applicators, so that means going directly through the skin. There's a little graphic here showing what the actual heating mechanism is. So we're radiating a microwave field from the applicator tip, as you can see on the left. On the right there, you can see what the effect is as you apply an electric field across a polar water molecule. And the water molecules simply flip up and down in response to the field. And the field is changing at billions of oscillations a second. And so you get very rapid, very effective heating from this microwave field. So it's very effective, it's consistent, it's radiating and interacting with water molecules in the tissue. And all tissues, all soft tissues are around 70% water. So the antenna in the microwave system only sees water surrounding it. So it gives you very consistent effects. Every ablation tends to be the same. It's very fast, and we can make bigger and more repeatable ablations than competing systems currently out there. So this photograph now shows just exactly how much we've brought the size down. The device on the right is an MTA applicator, which is used by surgeons, and that's 5.6 millimeters diameter. The device on the left is the new percutaneous microwave device at only 1.8 millimeters. So that's a liquid-cooled 1.8 millimeter device, which will generate the same ablation volume as the device on the right that's used in MTA. And so it's very, very effective in a radiological setting. Just to have a look at what this percutaneous device will do in the hands of an experienced radiologist. These are a couple of CT scans that were carried out in Germany, in Heilbronn, under a surgeon, a radiologist there called Professor Philippe Pereira. So the left-hand image, you can see approximately 15 millimeter tumour, the small dark area, that's the tumour. And this line here is the trajectory line that the professor plotted to access the tumour. Here's the post-operative CT scan after a 5-minute treatment at 180 watts. And you can see the volume of ablation that has gone on there. And this black bit in the centre is just some gas evolution there. And Professor Pereira was absolutely delighted with this result. You know, he'd not seen anything like as powerful and as effective as this. And he's very keen to carry on and do some treatments now in lung and further progress that work. Right, so a brief overview of the systems that we've got out there and the kind of impact that we're having in the world with our systems. So you can see for MEA, that's microwave endometrial ablation, we have 180 systems used in the UK, 95 USA, 35 Canada, and the rest of the world 110. So there's a total of 420 MEA systems out there doing gynecology work. MTA, that's the open surgical microwave tumor ablation system, 32 systems worldwide. And PMTA, the new percutaneous device, we have 31 systems out there. So for MEA, that's a total of 75,000 treatments done worldwide. So you know, it's a huge impact in that kind of surgical arena. MTA has done 660 already in a matter of 2 years. PMTA, which is only recently released, already has 53 when this chart was done. But since then, I've done at least another 15. So you know, we're up at around 70 treatments for that new system already. So future, where are we going to go from here? We are currently developing a high-frequency version of that PMTA device, which will make relatively small ablations, only up to about 3 centimeters, but very precise, highly spherical, and done in very short times. So we intend to target with this tumours in the lung, small multifocal tumours in the lung, kidney tumours, bone tumours, and prostate cancer. We have actually in place now a grant from the NHS, from the Health Technology Devices Group, to develop a bone cancer pain palliation system. The NHS are very keen on pain palliation at the moment, and these patients are terminal, but experience a great deal of pain by a tumour growing inside the bone marrow and applying pressure to the bone. So the customary treatment for that is radiotherapy, which is not too effective, and also huge amounts of analgesics. So the quality of life of that patient in their remaining time is very low. So if we can put in a small microwave burn into the tumour and shrink it down, we can relieve the pain in the bone, but not have to apply the analgesics that are currently used. So yeah, that's a very exciting project for us. We're looking at treating biliary tree tumours. That's a biliary system inside the liver, using flexible applicators deployed down endoscopes and through a small port in the stomach wall. Again, an exciting project. Also, we have a varicose vein treatment, which is pretty much ready to go, and very soon we will probably be putting that into commercial development. So this is a microwave system on a flexible catheter that you can treat varicose veins with, and it comes with a patented motion sensor system, and so it's quite a novel an interesting way of treating endovascular disease. And so that's all I've got for you today. Yeah.